Step into any of Parkway Health's hospitals in Singapore, and you will discover that quality healthcare means more than medical care. Parkway Health offers accessibility of specialized medical procedures, quality of personalized care, and treatment at its 3 well-established hospitals: Gleneagles Hospital, Mount Elizabeth Hospital, and Parkway East Hospital. At Parkway Health, quality healthcare is about total patient's experience. It is also about tender, loving care at every touchpoint in any of its hospitals. Our reputation for excellence has not gone unnoticed. Gleneagles Hospital, Mount Elizabeth Hospital, and Parkway East Hospital are Joint Commission International accredited, demonstrating our commitment to quality, safe, and efficient patient care. Recognized worldwide as one of the leading healthcare providers, Parkway Health has a pool of experienced medical specialists, invests in medical technology, and the right infrastructure to provide value-based integrated healthcare. Parkway Health offers clinical programs that are tailored for patients to experience holistic and comprehensive care under a team of specialists. With more than 1,200 accredited specialists covering over 40 multidisciplinary specialties, patients can expect quality care and be assured of our integrated facilities and expertise, which are grounded in good clinical practice. Whether patients' needs are basic or complex, they find reassurance in Parkway Health's facilities. To achieve quality clinical outcomes and for effective treatments, Parkway Health continues to invest heavily in proven and advanced medical technologies. Parkway Health also extends round-the-clock medical service through its 24-hour accident and emergency facility, providing care for life-threatening emergencies and minor urgent care medical problems. Parkway Health operates a patient assistance center to serve as a one-stop and 24-hour service center to help patients access specialists and complex medical care in Singapore. 24 hours a day and 365 days a year, our helpline service provides medical referral and assistance in over 10 languages. Our global culture means we know and understand our patients from their perspective. People from all over the globe have come to Parkway Health's 3 hospitals in Singapore for comprehensive specialist care. Beyond its reputation for medical milestones, patients come for the peace of mind, knowing they will receive quality care by our dedicated team of nurses, doctors, and staff who understand their special needs. In realizing our vision, we seek towards achieving quality clinical service and operational outcomes. This way, when our patients step out of our hospitals, we know we have made a difference in their lives. Parkway Health, your quality healthcare provider in Singapore.
Hello viewers, this is Dr. Chiam signing in today's Doctor's Voice episode from Singapore. Our today's topic of discussion is cardiology. The cardiology is a subject of medicine that deals with the disease of heart. For discussing about cardiology in studio, we have Dr. Paul Chiam with us. Viewers, Dr. Paul Chiam is an interventional cardiologist practicing in Mount Elizabeth Hospital, Singapore. After completing MBBS, he obtained MRCP from UK and a Masters of Medicine from Singapore. He was trained in USA and later on he performed the first transcatheter aortic valve replacement in Asia in the year 2009. Hello, Dr. Paul.
Hello.
Welcome to our show in Doctor's Voice.
Thank you for inviting me.
So, Doctor, what are the common heart diseases you encounter in your practice?
I think the commonest form of heart disease would be coronary artery disease, which means that there are blockages that develops in the heart arteries. And I think that really is the commonest cause of patients having chest pain. And of course that leads on to a heart attack that we see quite commonly nowadays everywhere in the world.
What are the common presentation of ischemic heart disease or coronary arterial disease?
So I think the commonest symptom that patients come complaining is chest pain or chest discomfort. And usually that is brought on by some form of exertion. For example, if they are doing some work, some hard work, or if they walk faster, climb stairs, then they feel the chest discomfort, and they usually describe it as a very tight, heavy sensation, like as if somebody is pressing down the chest. And then at the beginning, usually this is relieved by rest. But subsequently, as these blockages become more and more severe, then the pain becomes more and more frequent. And of course, the worst form of coronary artery disease is a heart attack, where the blood clots inside the artery, completely blocks the artery, and there's severe chest pain with sweating, breathlessness, and a sense of that the patient feels like he's going to pass out or die.
So we came to know that the cardinal manifestation of ischemic heart disease is chest pain. So there are other causes of chest pain also. So how to distinguish whether it is due to cardiac cause or a non-cardiac cause?
Yeah, so like I mentioned, the classical kind of a chest pain that the patient will feel is usually brought on by some form of exertion, some activity. And they always describe it as a sensation of tightness and something pressing on the chest. We also see many patients with what we call more atypical chest pain, where they describe it as something poking, or pulling, or something burning. And these are usually less likely to be, due to ischemic heart disease or blockages in heart arteries. So I think the story or the history that the patient tells us is very important. And of course, we have other tests just to make sure that this is indeed the pain coming from the heart arteries.
What are the common tests to detect ischemic heart disease?
So I think the simplest test that we can do in the clinic or in the office is what we call resting ECG, or resting electrocardiogram. Now this looks at the electrical activity of the heart, and if there is a significant blockage, sometimes we find that the ECG is abnormal. Saying that there are many patients with chest pain due to blockages in the heart arteries, but the ECG may be normal. Then in these cases where we still suspect that there is a blockage in the heart artery, then we proceed on to do what we call a treadmill stress test. I think that is commonly known as a treadmill test. And during the exercise, what we do is we are stressing the heart. The patient is exercising, the heart is under stress. And then we look at the ECG, which is monitored continuously during the stress test, and see if there's any abnormal changes. And by far, I think this improves the accuracy, to about 80% for patients that we are not quite sure whether it is a heart artery blockage or not.
Is there any role of blood test in detecting myocardial infarction or heart attack?
Yes. So the blood test cannot detect if there is artery blockages, but certainly if you have a heart attack, then some of these blood tests will show a rise in what we call a cardiac enzyme. But unfortunately, the earliest time when we can detect a cardiac enzyme rise is probably about 1 to 2 hours after the onset of chest pain. Now, which means that if the patient comes in really early, let's say half an hour, and the pain is still ongoing, sometimes the blood test may be negative or normal, but he is having or she is having a heart attack. In those instances, I think the ECG, if you repeat them carefully enough, usually we'll find something abnormal on the ECG.
What about other heart diseases you find? Especially, I'm sure that you have seen lots of Bangladeshi patients coming here and visiting doctors. So what are the other cardiac diseases you have found?
So I think the next big group will be those what we call valve disease.
Okay.
And of the valves, I think the two left-sided valves, the aortic valve and the mitral valve, are the most commonly diseased valves. In Bangladesh, for example, I think where a condition called rheumatic fever is still fairly common, one of the common diseases that we see is a mitral valve stenosis. The mitral valve is on the left side of the heart, and that allows blood to come back from the lungs to come into the left ventricle, which is a part where it pumps the blood out of the heart. Now, this valve tends to get narrowed in patients with previous rheumatic fever.
So stenosis means narrowing of the valve?
Yes, correct.
Okay.
And for this condition, there's a technique to treat it with the ballooning of the valve. Now, the other common conditions that we see increasingly is what we call aortic valve stenosis, again a narrowing of the aortic valve. The aortic valve is a valve that leads the blood out of the heart to the rest of the body.
Okay.
And as we grow older, this valve gets degenerated and becomes narrow. And with this valve, previously the only option was to replace the valve with open heart surgery. But as you mentioned, in 2009, I did the first procedure where I replaced the valve through a small incision in the groin without the need to cut open the chest or put the patient on a bypass machine.
So nowadays, valve surgeries are being valve diseases can be treated without open heart surgery via transcatheter approach. So can you please explain transcatheter approach for our viewers?
Yes. So for the aortic valve, at least the procedure, what we do is from a small hole in the groin, just as if we would do a angioplasty of the heart artery. Now from the small hole in the groin, we put a tube into the artery in the groin, and this leads back to the heart. And from this approach, we put a wire across the aortic valve, which is now severely narrowed. And then subsequently, we will put a new valve that is loaded into a tube. Okay. And this goes through the artery in the groin. And then we deploy or we release the valve to completely take over the valve function of the aortic valve in the patient's body. And this is done on a beating heart and without the need to cut open the patient's chest.
We will listen again about the heart valves and the other factors of ischemic heart disease just after a short break. Dear viewers, we are taking a short break. Stay with us. Dear viewers, welcome again. We were talking about cardiology, valvular heart disease, valve-related disease of the heart, as well as ischemic heart disease with Dr. Paul Chiam, consultant cardiologist of Singapore Mount Elizabeth Hospital. Please be with us. Okay, doctor. So we were talking about type of valves. So please, can you please explain for the patient type of valves and other important factors to be considered in case of ischemic heart disease presentation, management in detail?
Yes, so I think we'll start off with ischemic heart disease since it is the commonest form of heart disease. So most patients with ischemic heart disease present with chest pain or chest discomfort, but many patients also present with shortness of breath on exertion without the chest pain. And especially I think this is seen in patients with diabetes where they don't feel so much pain but more shortness of breath. And the main cause of this ischemic heart disease is narrowing of the heart arteries due to cholesterol buildup. And as we know, most patients will have either chest pain or shortness of breath. And in some patients, this narrowing or cholesterol buildup in the arteries can lead to a heart attack.
So what are the common risk factors for developing a heart attack or getting ischemic heart disease?
So the risk factors, I think most commonly will be having diabetes, high blood pressure, high cholesterol, smoking. I think these are common factors that happen in many patients and which can be reversed. Of course, there are many reasons, many other factors that sometimes we do not have control of. For example, family history. As the older you grow, the more likely...
Non-modifiable factors.
Yeah. Non-modifiable factors which we cannot do anything about. But I think by far, the things that are most important to me, at least in my practice, will be patients with diabetes, high blood pressure, high cholesterol, and smoking.
So you are telling that after, by controlling blood sugar, blood pressure, and lipid level, and quitting smoking, a patient can be stay away from the heart disease.
Yes, maybe you cannot prevent it completely, but you will reduce the risk by quite a lot for each patient. And I think that's significant.
So what are the treatment modalities in case of ischemic heart disease or heart attack after an MI?
So for a heart attack patient nowadays, when they come into the emergency room, I think this is an emergency because the faster we open the blockage of the artery, the heart attack means that the artery is completely blocked, the more muscle we save. The more time we waste, the more muscle dies. So nowadays, the treatment of choice is really what we call emergency angioplasty or ballooning of the artery. So we will bring the patient straight to the cardiac lab, the laboratory, and where we will put a tube into the heart and then use a balloon to open the artery to save the muscle. So that is an emergency procedure to save the muscle and also save the patient's life in terms of for heart attack patients. Now, for patients with ischemic heart disease who are not having a heart attack, I think the initial treatment will always be medicines first. Blood thinners like aspirin, control the sugar, cholesterol, blood pressure, and also we can give some medications to reduce the chest discomfort. But in many of these patients, this may not be enough. And again, the option is to perform angioplasty or ballooning of the heart arteries. And in some patients with a lot of blockages or who have conditions like diabetes, perhaps an open chest bypass surgery might be a better option for them.
So what are the complications patient may develop after having an MI?
So patients who are having a heart attack, which is an MI, are at risk of sudden death because the muscle is, there's not enough blood supply to the muscle. The muscle may become what we call irritable and go into a very fast and dangerous abnormal rhythm, and that may kill them. But if they survive the initial period, then our main worry is that the muscle is damaged and the heart becomes weak. Just as a car, if there's an engine that's 4 liters, if you damage 2 cylinders, then your car is not going to run very well. Yes. And similarly, a patient with a damaged heart, if the heart is weak, they will start to feel breathless when they exert. The worst case scenario is that they may have repeated heart failure episodes which require hospital stay.
So what are the other causes of heart failure and how the patient usually manifests in case of heart failure?
So again, the commonest cause of heart failure is due to ischemic heart disease, but the other big cause of heart failure is valve disease.
Okay.
And the valve disease, the aortic valve and the mitral valve are 2 valves on the left side of the heart. They are the commonest ones which can cause heart failure. And when a patient has heart failure, the main problem is that they become breathless. Initially, maybe they are breathless on walking, but subsequently the breathlessness becomes more and more severe such that they may be breathless even at rest. Okay.
Can you please explain the basic disturbance in case of heart failure for the viewers in a short term?
So in heart failure, what happens is that the heart is pumped. The pump has become weak. So imagine that you are using this pump to pump water out of a tank, and the blood is the water that you want to pump out. Now, if the pump is weak, you cannot get rid of the water in the tank, and this water then pools in the body. The legs become swollen, or it may go into the lungs, and the lungs become locked with water, and the patient becomes breathless, and the legs become swollen, and they feel very, very unwell.
And another thing that we were discussing about the valvular heart disease and the rheumatic fever, which is very predominant in our country and is the leading cause of valvular heart disease in Bangladesh. So we were discussing about an approach through a catheter in treating the valvular heart disease patients. So what can be the complication after TAVI, that is transcatheter aortic valve implantation?
Yes, so the transcatheter aortic valve implantation is now a technique to replace the aortic valve without the need for open heart surgery or the need to crack open the chest. Now, of course, as with any procedure, there are still risks involved with changing this valve. And usually when the problem with the aortic valve stenosis or narrowing is that the patients usually are quite old because the valve degenerates as we grow older. So the risks are also similar to open heart surgery. As in any procedure, there's a risk of stroke, death, and of course, things that are more peculiar to the aortic valve, we may need a pacemaker after that. But as compared to heart surgery, perhaps the risk might just be lower, and I think the patients do recover faster from this minimally invasive approach as compared to open heart surgery.
Open heart surgery. Okay, Dr. Paul, we will be talking about the rest of the conditions of heart just after a short break. Dear viewers, we are taking a short break. Stay with us. Dear viewers, welcome again. We are talking about heart disease with Dr. Paul Chiam. So, sir, what about there are some conditions we have heard that heart function may be worst during pregnancy. It may get worst. So, what are the conditions and what is the treatment approach?
So, I think what we're talking about here is a condition called peripartum cardiomyopathy, okay. And that happens when a pregnant woman, for some reason that we don't really understand, the heart muscle becomes weak during pregnancy. Now, the fortunate thing is that it is quite uncommon. In fact, it is rare. But it can be, for those patients who have this condition, it can be quite severe. So basically, the heart muscle becomes weak, and they will have problems, the heart will have problems trying to pump the blood around the body. The patient will become breathless. They may have swollen legs where the water is retained. And it can be a difficult time for both the mother and child because you have to also worry about the delivery of the baby.
Thank you, Dr. Paul, for being here. And our audience will be definitely benefited by your tips and suggestions.
Thank you for inviting me.
Thank you. Thank you. Viewers, we were talking about cardiological problem, heart-related problem with Dr. Paul Chiam from Singapore Mount Elizabeth Hospital. That's all for today. We hope you have learned many things about the heart disease. Stay fine, tuned, and stay with Doctor's Voice.
This hospital will raise the bar in terms of the delivery of private healthcare standards to its highest form.
Anything you can think of, you have the best of the best working in this hospital.
Patients deserve the best of technology and the best medical care.
It's a very beautiful place.
I'm Dr. Tan Seeling. I'm the Group Chief Executive Officer and Managing Director of Parkway Pantai Limited, the holding company that built this hospital. I believe that this hospital would put Singapore on the world map. We've invested in state-of-the-art technology, medical equipment, and the entire hospital is built centered around the patient as our main focus.
I think being a patient at the hospital is really an experience for all the senses. I feel really at ease here. There are a lot of green spaces around the hospital which my family and I can relax in, and it really cheers a patient up to have sunlight streaming through the windows and you can't even feel the heat.
We believe that the healing of a patient's illness itself is a very holistic process, and we hope that this becomes an oasis of healing, an oasis of calm. So while we put in the best medical equipment, we have the best doctors and nurses taking care of the patient, we also believe in using the environment, making it a very, very comfortable, private environment for the patients to recover. The team spent no effort in scouring the world to find out what is going to be cutting edge and what is the future that's in store in terms of medicine.
The advanced technology that is available at Mount Elizabeth Novena represents what state-of-the-art medical technology. We've got a state-of-the-art operating microscope that allows us to see beyond the surgical field, and that's critical for minimally invasive keyhole surgery. We've got the ability to check our work and ensure that we get the best results possible.
Some of the cutting-edge equipment that we have ranges from imaging equipment like the Biograph MMR. We can get very clear, detailed images onto the activity of the parts in the body without the risk of course, radiation.
The list of firsts at Mount Elizabeth Novena is really impressive, and this includes some lead-lined rooms which we use for patients with thyroid cancer, and we use them to actually give them radioactive therapy. And we're actually the first private hospital in the region to have them.
We've got a platform from an IT end that allows us to retrieve information, link up information, present data.
The beauty of electronic medical records is that we can access the records from any part of the hospital, anytime, without fail. And quick access means for faster, more efficient care for our patients.
We use the pneumatic tube system to send samples to the laboratory for quick testing, so that the doctors can access the results almost immediately.
The laboratory support is really impressive. Patients can actually have their blood tests taken and expect their results back in as short as 2 hours. And this means that even international patients can fly in, have the test done, and expect to be home maybe within the same day.
This all translates to shorter operating time, better clinical results, and of course we've got a brand new ICU here, thoughtfully designed, capable of looking after complex, difficult and very ill patients, and which is really what we want, because the patients deserve the best of technology and the best medical care.
There are 250 medical suites in this building, and we have specialists ranging from neurosurgery, cardiovascular, anything you can think of. You have the best of the best working in this hospital.
The clinics are actually linked to the wards on every floor, and this is really important for us because it allows us access to our patients in the wards at all times and enables us to keep a really close watch on them while they're recovering.
What's really impressive is that access to advanced medical treatment can be done within 48 hours. A simple weekend away for medical treatment is now a real possibility within my busy schedule, and that's life-changing.
The staff, they're really warm and professional, and they always greet you with a smile. That's fantastic.
This hospital is really on top of technology, and I particularly like the other touches of technology that kind of completes the experience. There's Wi-Fi everywhere, and I can keep in touch with my family and stay online. And the patient console is a unique and nice feature that keeps everything within reach, like ordering food and of course selecting entertainment channels.
I've been a professional chef for the past 20 years. We have catered to many events and many products, but it's the first time I'm doing an opening for a hospital. that position themselves 6-star. We have a cross-cultural menu that includes a symphony of cuisine and different cooking techniques as well as variety on the menu. We believe that by offering this kind of variety is sort of an excitement for the clients, that there will be something that they definitely want to look forward to for tomorrow's meal or the meal that's coming after.
No effort is spared in making sure that patient privacy, patient comfort and patient safety is not compromised in any way.
I like the garden very much, and the fountains and flowers. It's a very beautiful place.
A hospital that harmonizes the best technology with nature. It's possible.
The best of medical specialty under one roof. It's possible.
An exceptional team with extraordinary touch. It's possible.
A 5-star hospital cuisine is possible.
Care, comfort, and complete privacy. It's possible.
The hospital of tomorrow, here today. It's possible.
Service quality and speed with a human touch. It's possible.
Revolutionizing and setting a new paradigm in private healthcare. It is possible.